How is mean arterial pressure, MAP, measured? Have you ever wondered how healthcare professionals measure something as vital as mean arterial pressure? This measurement is key in understanding hypertension and assessing cardiovascular health. Let's break it down in simple terms. Mean arterial pressure, often referred to as MAP, represents the average pressure in your arteries during one heartbeat. It is an important indicator of how well blood is flowing through your body. To measure MAP, there are a couple of methods used, both direct and indirect. For the most precise readings, healthcare providers may use an arterial catheter. This involves inserting a thin tube into an artery, usually in the wrist or groin. A device called a transducer is attached to this tube to continuously monitor the arterial pressure. This method provides real-time data and is often used in critical care settings. If direct measurement is not possible, MAP can be estimated using blood pressure readings taken with a cuff. The formula for this calculation is straightforward. You take the diastolic blood pressure, which is the lower number, and add 1/3 of the difference between the systolic blood pressure, the higher number, and the diastolic blood pressure. Another way to calculate MAP is to take 1/3 of the systolic blood pressure and add 2/3 of the diastolic blood pressure. Both formulas give a close approximation of MAP. In many clinical settings, non-invasive methods are preferred. Devices like blood pressure cuffs or oscillometric blood pressure monitors can automatically calculate MAP using built-in algorithms. These devices are user-friendly and often provide more accurate results than manual calculations, especially for patients with unusual pulse patterns. Understanding MAP is essential in the context of hypertension. A normal MAP typically falls between 70 and 100 millimeters of mercury. If the MAP is below 60 millimeters of mercury, it may indicate that blood pressure is too low to supply vital organs with adequate blood flow. Conversely, a MAP above 100 millimeters of mercury can indicate high arterial pressure, which may lead to serious health issues like blood clots or heart damage. Monitoring MAP helps healthcare providers evaluate the effectiveness of treatments for hypertension. It allows them to track changes in blood pressure over time and make necessary adjustments to medications. In cases where MAP readings are abnormal, treatments may involve medications to raise or lower blood pressure, depending on the situation. So, whether through direct measurement or estimation, understanding how mean arterial pressure is measured plays a significant role in diagnosing and managing hypertension. It is a key component in ensuring that our cardiovascular system remains healthy and functions properly.